What do you understand that document to be?
It's part of the Dental Practice Act in Colorado.
What is the Dental Practice Act of Colorado?
It's the legislation that affects how we do dentistry in the state of Colorado.
It's the rules set by the state of Colorado for how the practice of dentistry may be lawfully conducted. True?
True.
Objective form.
All of those rules apply to you as a Colorado dentist, don't they?
Yes,
You were a dentist practicing in Colorado in 2004, right?
yes,
And after 2004, correct?
yes,
And you are bound to follow these rules, aren't you?
yes,
Now, these are rules, aren't they?
Objective form and foundation, absolutely.
yes,
They're not suggestions.
Objective form and foundation.
no,
They're rules that must be followed by a dentist practicing in Colorado. True?
Objective form and foundation.
yes,
Okay. Let's look at 12-35-113, Section 1. You see that at the very top? A person shall be deemed to be practicing dentistry if such person, colon, you see that?
yes,
And then under B, is a proprietor of a place where dental operations, oral surgery, or dental diagnostic or therapeutic services are performed. You see that?
yes,
What do you understand that to mean?
Foundation.
I understand that to be that the owner of the dental operation or dental practice needs to be a dentist.
No, they're required to be a dentist.
Okay,
Objective form. You want to argue with this witness?
Is that true? They're required to be a dentist.
Objective form.
yes,
Okay. Let's go to 1235-116, which is about 4 pages in.
I just have to object for the record. These are statutes. There's 3 sets of documents within that are related to the Dental Practices Act. The Dental Practices Act are statutes. The Dental Board has a set of promulgated rules. It also has a set of promulgated policies.
You see that page?
yes.
Okay. I'd like you to read 1235-116, paragraph 1.
Okay.
And what do you understand that to mean?
I don't understand what they consider a corporate capacity. I'm sure that somebody could give me that definition, but as far as I'm concerned, the practice of dentistry is an individual thing with me, and the way that I do it is the way that I do it, the way that I was taught.
How long have you been bound to follow the Colorado Dental Practice Act,
Since I received my Colorado license,
which would have been when?
2003?
And if I understand you right, here we are 11 years later, and you're saying you don't understand what it means when it says the conduct of the practice of dentistry or dental hygiene in a corporate capacity is prohibited?
Objective form, argumentative.
I don't understand the term in corporate capacity.
Did you ever made any attempt to find out?
No?
Do you care?
Objective form, argumentative.
No, I do not.
Okay. Let me ask you to take a look at 1235-129, which is another couple of pages in.
$139 or $129?
129.
Okay.
Do you understand that to be a list of specific conduct that a Colorado dentist may not do?
Objective form.
Yes.
Go down to section G, where it says aiding or abetting in the practice of dentistry or dental hygiene, any persons not licensed to practice dentistry or dental hygiene is defined under this article. You see that?
Yes.
If Forba, New Forba, or Church Street actually owned and operated those dental clinics, that would be a violation of the Dental Practices Act, wouldn't it?
Form and foundation.
Objective form and foundation.
I would assume so, yes.
And if you aided and abetted them in the illegal practice of dentistry, that would be misconduct on your part, wouldn't it?
Objective form.
Yes.
And as a matter of fact, you know that Church Street actually owned those clinics after they bought them in 2006, don't you?
Objective form and foundation.
No.
You were a salaried employee of Church Street or Forba from September 2006 until here a month or so ago.
Yes.
To form.
And you had professional fees for the services that you rendered to Medicaid children during that time period that were billed in your provider number, true?
Yes.
And all of that money went to Forba, didn't it, or Church Street?
Objective foundation.
I'm assuming that that money went to the clinic that I was working at.
What do you base that assumption on?
I don't know.
Okay. Forba or Church Street had their name on the salary checks that you received, did they not?
Yes.
And Forba or Church Street had their business name on the checks that all of the staff of the clinic received, true?
Jim,
I don't
again,
know.
you're after September 26, 2006 here with this line of inquiry.
I'm talking about New Forba.
Okay.
I don't know what the checks for the employees look like.
Have you ever seen a check written to anybody in the name of the clinic?
Not that I'm aware of.
Okay. So as a practical matter, can we say with a fair amount of certainty that you know the money went to Forba?
Objective form, foundation.
I'm not sure where the money went.
Okay. And you made no effort to determine?
No.
Okay. Let me direct your attention back to the prohibited conduct of 1235-129 and ask you to go to paragraph little v on the next page.
You say V is in Victor?
V is in Victor. Do you see that?
Yes.
What do you understand that rule to prohibit?
I don't understand that.
Why don't you read it aloud and see if we can figure out
Sharing
together.
any professional fees with anyone except those with whom the dentist or dental hygienist is lawfully associated in the practice of dentistry or dental hygiene, except that it is not to be considered a violation of this paragraph if a licensed dentist or dental hygienist pays to an independent advertising or marketing agent compensation for advertising or marketing services rendered on the licensed dentist or dental hygienist's behalf by such an agent, including compensation that is paid for the results or performance of such services on a per-patient basis.
All right, so let me see if you and I can parse that rule so we understand it together. The first part of the rule says you may not share your professional fees with anyone who, unless you're lawfully associated in the practice of dentistry. True?
Objective form,
Yes,
foundation.
And the second part gives an exception that says it's not considered a violation if the licensed dentist pays to an independent advertising or marketing compensation for advertising or marketing services. You didn't pay your professional fees to an independent advertising or marketing agent, did you?
Objective form and foundation.
no, but that's part of what the management company did.
Well, maybe part of what they did, but how much of your professional fees did you pay to Forba or Church Street as an independent advertising or marketing agent compensation? How much do you pay of your professional fees for that?
Objective form, foundation.
I couldn't tell you how much.
And they aren't independent because they were actually your employer. You were a salaried employee of New Forba, true?
True.
Objective
So
form.
they're not independent, are they?
Objective form.
What foundation?
Have you ever even thought about the idea that it's a violation of the Colorado rules to share your professional fees with a non-dentist?
No,
Foundation.
Do you care?
Objective form.
yes, I care. I am not real sure that this applies, but
Yeah, as I was saying,
When the Colorado legislature says that you may not share professional fees with anyone except those with whom the dentist or dental hygienist is lawfully associated in practice of dentistry, isn't that fairly clear what they're prohibiting?
Object.
Objective
Well,
form.
you're aware that, have you been sued as a party in this case?
yes,
And part of the allegations that you understand you were sued for is you've deliberately and intentionally facilitated the illegal corporate practice of dentistry by Church Street and Forba and Old Forba. You understand that, don't you?
Objective form and foundation.
no, I don't understand that.
Okay.